And let's go. We are live. Ask the Doc, Perry Girls TV. Welcome everyone. Flip the camera around, my friends. Let's see. Uh-oh. Come on. Hello, ladies. Hello, guys. Welcome. I am on my iPad today. Let me make sure I got my stuff together. Hold on. Hold on. There we go. Hi. Hi, PG Ninjas. Hi, WebEV. Hi, Joanne. Thanks for sharing. So, I have my iPad today. This girl is on fire. Hey. Hi, she be knowing Miss Joanne. Hi. So, for those of you all who have joined me before, hi, Rod Ray. You know that I have my Android phone. Don't be mad, Joanne. I know I'm trying to get it together. Thanks for inviting followers, PG Ninjas. Okay, I'm going to do like this. I'm going to sit up. Yes, welcome. So, for those of you all who have joined me, hello, good afternoon, Tori de Dios. I am Dr. Nicole Swiner. I am out of Durham, North Carolina. And if you joined us for Ask the Doc, hi. If you've joined us for Ask the Doc on PGTV before, then you know that my Android phone sometimes acts up at about 5 minutes till the end of our show. So I've switched to my iPad. Hopefully you guys can hear me okay. Can you hear me okay? I'll make sure we're doing all right. Technology, man. So Webby, perfect, Joanne. Thank you. All right, so good. Perfect. So I'm okay, and I'm going to sit up nice and straight, and we're going to get ready to chime in here. Okay, welcome. Happy Wellness Wednesday. Disclaimer. Thank you, PG Ninja. So I am a primary care doc. I'm a family. You got the sugar. We're going to talk about it. I'm a primary care doc. I'm a family doc. That's my bread and butter. However, when we talk about certain topics, if you think you might have problems with or issues, please check in with your own doctor just to confirm things and get your own specific questions answered. Hello, ADHD Coach Lynn. Welcome. All my Perry girls are in the house. Welcome. And for those of you who, again, might be joining us for the first time, Perry Girls is a wonderful group of now 11, almost 11. Oh, move it to the left. Like that. WebEV, you got me? Okay, angle it down. Is that better? More to the left. Excuse us, the Perry Girls are getting my technology going right. How's that? That does look better. Is that better? All right. Excuse us with our technological difficulties. Hey, reality. Yeah, perfect. Good. Okay. Perry Girls is a wonderful, as you can see, wonderfully supportive group of women on Periscope, and it's now 11,500 strong. Thank you, WebEV. Of supportive women on broadcasting. If you want to learn more about social media, whatever, get some help with that, please join us at Perry Girls TV, Periscope, Perry Girls on all social media. We take real good care of each other. Hello, Reality Goddess. Perry Girls TV, by the way, we have a couple of different TV shows that we broadcast. Hello, Perry Girls TV, that we broadcast throughout the week. Please check our listings. Reality Goddess, I believe, is one. We have a yoga show, a cooking show, a wine tasting show. I do your health and wellness. We have whatever you can think of, it's there. So excited to be part of it. There you go. pgtvguide.perrygirls.com. Okay. I am your Superwoman complex expert, as well as your mental health expert, because I am a I am a family doc, so I take care of things from the cradle to the grave. Chronic conditions, women's health, minority health, pediatrics are my loves. Talking about the Superwoman complex is my thing. It's my niche. I talk about how women can take better care of themselves mentally, physically, spiritually, emotionally, and all of that. A lot of this, smidge to the right. Still getting it right. How's that? Is that better? But today, thank you, Perry Girls. Yep, DocSwanner.com. That's me the other way. I'm just going to cut out my whole little name back here. We're going to talk about the sugar today, guys, as we get the camera angle straightened. That's perfect? All right. We're going to talk about the sugar. The sugars. Diabetes. Yeah, it's the iPad. Okay. Thank you. Diabetes is a very clearly devastating disease. If you live in the western part of the world, in the U.S., the sugar, that's exactly how we say it in the South especially. It's a devastating disorder. Sugar is a problem, both, literally and figuratively. And all of us have probably been touched by it in some way, right? So mothers, fathers, sisters, brothers personally dealt with it, have it, at risk for it. So it's definitely something we need to talk about more and be more proactive about, okay? I like to say that, even though you have a significant family history, it doesn't necessarily mean you have to have it, okay? So it's not like, cancer per se or some other genetic disorder that you are born with. For the most part, diabetes type 2, type 1, you export it with sugar, pretty much. It is, unless you're born with type 1 or you're born with a gene where literally you come out of the womb with it, there are ways to avoid it. You can prevent it. It is a preventable disease. So that's right. And even once you're diagnosed, it's not a death sentence. You're right. So let's talk about it. So let's see. I always like to do a little pop quiz, to see what level of understanding we're at to begin with. Tell me what an abnormal fasting blood sugar would be. So above what number is abnormal fasting sugar? Pop quiz, here we go. You ready? Later I might even give a prize. I like giving away stuff. Above 100, WebEV says 140. So fasting above 80, okay. Hadn't hit it yet. The reality guys. Hello, welcome to those who are joining. 110 close. Make sure to hearts like you're doing and share it out to your Twitter and your Periscope followers. 7, Joanne. 120 is close, WebEV. It's 125. 125. This is from the American Diabetic Association. There you go. So any fasting, that means you haven't eaten in 8 hours. Fasting blood sugar greater than 125, right? Sorry. Can diagnose you with diabetes. Or if at any point during the day, no matter when you've eaten, anything above 200, diagnosing you with diabetes, okay? So again, fasting blood sugar, meaning you hadn't eaten in 8 hours. Normal is 101 and 120 for diabetes. It depends on what you read and what literature you're following. I'm taking this from the American Diabetic Association, so they're kind of the gurus, the experts. But I should have, but I did. Yeah. So any fasting blood sugar, that means you haven't eaten in 8 hours, above 125, and then at any point during the day, doesn't matter when you've eaten. If you're ever above 200, diabetes. Okay. It might be different for pregnant women. Hi, welcome Stock 3024J. Different for pregnant women, but in general, that's the diagnosis. Who's heard of a hemoglobin A1c? Do you know that term? Hemoglobin A1c. It's not the same as, saying one, raising your hand, good. It's not the same as, your blood cells, meaning, I'm anemic, so my hemoglobin is low. It's different. Hemoglobin A1c is a 3-month average of all your sugars put together on a scale. And what we do is so it doesn't matter whether you've eaten or not. We can do a finger stick, we can check your blood, check your hemoglobin A1c, and over 3 months it kind of puts all your numbers together and scrambles them, puts them on a scale between 4 all the way up to 13 and undetectable. That's another way that we can diagnose or see if you are at risk for diabetes or pre-diabetes. And yes, there is such a thing as pre-diabetes. But anything above an A1c of 5.7, which means that your average sugars are probably 80s to 90s. Anything above that on average puts you at risk for diabetes or in the pre-diabetic range. If you're above 6.5, which would put your general average sugars in the 130s, 140s, then you have the diagnosis of diabetes. Custom diabetes log sheet. Oh, okay, for her to check her sugars. Very good. Yes, that's my website, DocSonny.com. Thanks, guys. You can always join me. So that's the diagnosis, okay? Now let's talk about how you feel, okay? Diabetes, unfortunately, can be a silent killer. There are a lot of silent killers in medicine, meaning you feel great. Oh, the A1c. Okay. So an A1c of 7. Again, depending on who you read, this is from the American Diabetic Association. They say 6.5. Once you are diagnosed with diabetes, you want to stay under a 7. A1c. Hello, L. Rodriguez 03. So diabetes, unfortunately, is in the category of those silent killers that we've talked about before. If you've joined me before, we've talked about hypertension, high blood pressure. Most of the time we're walking around, we feel fine, our body adjusts, sleep a lot and give you headaches. Having high sugar can, reality goddess, yes, it can make you sleep a lot and have headaches. But sometimes you don't feel it at all. Hi, Disciple Paul. Welcome. Hearts, 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 and share. We like sharing out to Periscope and Twitter. Often it is silent, meaning you were feeling fine. 2:43 a.m. Is that your sugar? I hope not. Oh. So it can be silent. But, hi, welcome everybody. Usually you will feel something. Yeah, don't get checked out, reality guys. And again, disclaimer, always check in with your own primary care physician. But usually we'll feel symptoms of fatigue. The 3 P's, polyuria, polydipsia, polyphagia. That means peeing a lot. What did I say next? Polydipsia is drinking a lot. Polyphagia is eating a lot for no reason, okay? Along with unexplained weight loss. So not, I'm drinking a lot of water to try to lose weight and I'm exercising, I'm cutting back calories and I've lost weight. It's I'm doing my normal routine and all of a sudden peeing a lot, always thirsty so I'm drinking a lot, always hungry so I'm eating a lot, and weight loss. Those are like the cardinal symptoms of diabetes, okay? Again, check with your own medical professional. And speaking of that, I've also talked about the importance in the past about, making sure that you're getting your up-to-date checkups, your preventative health, your annual exams, because with that, often comes labs, right? So you're getting your blood work done, you're getting your lab values checked, and sugar is often part of that. So they'll check your random sugar, right? So you at least yearly, you should be checking in with your doc, and if you're above 35, I would say, definitely make sure that sugar is part of that screen, right? I now also throw in an A1c. I do a hemoglobin A1c for the majority of my folks that are adults and are getting their physical exams. Because again, silent. Often we don't know what's there. You don't know that you're supposed to be watching your sugars until your A1c is checked or your sugar is checked. It's high. And you're like, oh, okay, well now I can do something about it. Okay? So get your annual exams. That was a quick plug for the importance of annual physical exams. So once you're diagnosed, whether or not you feel the symptoms, answer me this. Does that mean you immediately have to start medication? Yes or no? Hi, so ready to go? So let's say I come in, my A1c is 7, I feel great, I'm otherwise healthy. Does that mean I have to start medicine immediately? No. They are correct. No. No. And insulin. Does it mean you have to start insulin? No. No. Does it mean you're a diabetic, though? It does. It does. So we need to know that because we need to know the right ways to prevent it, okay? So let's talk about prevention, or let's talk about diet and exercise control. There you go. Exercising, changing your diet, works. Decreasing your carbs, decreasing your starches. We should all do this in practice anyway, whether or not you're diabetic. Cutting back on carbs, cutting back on sweets. Your carbs also include the white stuff. Rice, pasta, potato, bread. So not just cake, ice creams, and candy. Rice, pasta, bread, potato. The white stuff. Carbs, starches, increase your blood sugar. So pre-diabetes, reality guys, good question. Pre-diabetes is anywhere from an A1c of 5.7 to 6.4. Okay, that in between. I know. Don't be sad. You can fix it. You can fix it. Blood sugar is still high. If you're eating healthy, exercising, and your blood sugar is still high, you need to treat it. There can be devastating effects from having high blood sugars for years, even if you don't feel bad. Devastating effects. It can damage long-term your kidneys, your extremities, right? Your particularly your legs and feet, your brain, your heart, your eyes. Devastating effect. Good question. Metformin is used for a lot of different reasons, not just diabetes, but if you're taking it for diabetes or pre-diabetes, I even have some pre-diabetics who, my mom had diabetes, my dad had diabetes, my A1c is 6.1, I'm nervous, I don't want my sugars to go up, take metformin, so we can use it for pre and for real diabetes. Metformin helps your body to recognize its own insulin. So we all produce insulin, right? Pancreas, which is in the middle of our tummy, is that organ that produces insulin. It helps us to regulate sugar. All of us are born with insulin. But at some point, sometimes our bodies don't respond to insulin as much, or we stop making it. And that's the difference between the different types of diabetes. Metformin helps your body to respond better to its own insulin. So it's kind of helps your body to operate more efficiently. Hi, Jamila M. So that's how metformin works. Some people can't tolerate it. It's usually the very first medicine we put all diabetics on because it works really, really well. Some people can't tolerate it because it can hurt your tummy. And, we got to make sure your kidneys and your liver are straight and all that. So, but it's the gold standard. It's usually the first one that we try. So that's metformin. But hopefully, if you are borderline or you have a significant family history of diabetes, you can fix it by cutting back on those starches and those carbs and then exercising regularly. They work. They work. They work. I have a number of diabetics. Share. Thank you, guys. Yeah, share it and swipe and all that. I have a number. Hey, Destin Doc. Oh, you got a new pair. Oh, look at you, fancy, with a new handle. Hi, Destin Doc, one of my faves. I have plenty of diabetic patients who are diet controlled. Don't have to take medicine, okay? It is possible. Do you still have to continue monitoring and making sure you're checking your sugars? Yes. Do you still have to make sure you're getting your eyes checked once a year to make sure you don't have any damage to your eyes? Yes. Do you still need to maintain good blood pressure and watch your kidney health and make sure you don't have, kidney disease? Yes. So even though we're not on medication for diabetes and we're doing a great job controlling it with diet and exercise, we still have to take those precautions to make sure that we're protecting the rest of our body from complication. Okay? So we talked about metformin. Let's talk about when we need to go ahead and just be on insulin. And I'll give you a couple of different scenarios. Insulin means, or being on insulin means that your body either is no longer, I'm stressed if you're diagnosed. Good question. Hold that thought for a second. Good question, PG Ninjas. Don't cry, reality guys. I'm here to give you encouragement. You can do it. You can do it. Get checked and you can fix it. When someone needs to do insulin, by the way, insulin is probably not what you think nowadays versus the old school days. Old school days, you're thinking about giving yourself multiple shots in the belly and the stomach and the legs, and you got to carry the stuff around. You got to refrigerate. Comes in a little clicky pen now. Convenient. Don't have to keep it refrigerated. 1 shot a day sometimes. Okay. So even if you have to be on insulin, it's not a death sentence, and it doesn't mean you'll have to be on it for the rest of your life. Okay. You can change these things, but it's a good thing. I mean, it's a good drug. It works as effective if you have to use it. Usually when I start talking about insulin, it's because their A1c is climbing above 8. Yeah, I know, reality goddess. We can do it. Hi, C. Wiggins. Perry girl, welcome. So once your A1c starts climbing above 8, again, it depends on who you read, but usually I use 8 as a rule of thumb. Hey! That means your sugars are climbing on average above 180. Then that means that insulin is probably needed. Because, hi, welcome, Jackie G 123 Charm Doll. Your body is either okay, let's keep it real. Either you're not doing what you're supposed to be doing, right? You're not following good diet and exercise program, may not be taking your medications that you're supposed to. Oh, I skip it on some days, or, I didn't eat sugar this day, so I didn't take it. You're doing willy-nilly stuff. I like to say willy-nilly, your own program. Or, we're born with a certain amount of insulin, and that's all you get. Tap, 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 share. Over time, your body produces less insulin. I mean, that's just a fact. I mean, think about it like a battery. We're only born with a certain amount, and those cells in the pancreas will wear down after a while. So some people, even once they do great, borderline type 2, yeah, Catherine. Catherine, you're a health fit nut, so you know how to help them with diet and exercise, hopefully. I know. Web, even make sure you're taking your medicine every day. My thought is either you if you're prescribed a medication, either you take it every day or don't take it at all. I would rather you not take a medicine at all versus taking it on Monday, Wednesday, Friday, and then not taking it the rest of the time. It's not gonna do anything for you. It's going to increase side effects. Web EV. Shame. That's okay. That's why we're here for encouragement. Take your medicine or go talk to your doctor, right? Yeah, you gotta watch the ice cream and the carbs. Hey, Sean Knight, welcome. We're talking about the sugar. By the way, commercial again. I am Doc Swiner. My son is off to the side. Join my channel on Perry Girl or Periscope as well. And then welcome. Go back to the doctor. Welcome to Perry Girls TV, PGTV Ask the Doc. We're talking about the sugar. And we're helping Web EV get herself back together. All right, yes. Watch the entire lineup. So Insulin, okay? So insulin above an A1c level of 8, okay? Or if you're type 1 and your body just does not respond to the medications, okay? Sometimes you need it. Again, doesn't mean necessarily for everybody you have to stay on it. Sometimes I use the threat of the needle. If I have a patient that comes in and it's like their first time, thank you, I love you too. It's the first time their A1c hit 8, sometimes I'll threaten them with the needle. I was like, all right now, you know, above 8. What did I say today? I said A1c of 8 means insulin, okay? Stress, yes, stress. And then usually they'll get their act together, start taking their medicine, diet, exercise, and it comes down. Then we don't have to do it, okay? But I even have those who will need a shot for whatever reason, and then they got their act together, their A1c came back under 8, and then we were able to take away the insulin. Perry Girls TV, I think, asked a question about stress. Yes, stress can increase your blood sugar over time. Absolutely. Absolutely. Other things. Hi, Milton, Tyler Zaddy. Being on steroids. So if you've had to take prednisone often, whether it be for bronchitis or for pain or for allergic reaction, or you've gotten steroid shots, like you get, joint injections, or you have chronic pain where they have to do epidural shots, for pain control, that can also increase your sugar. Ooh, okay. Did you have something that shot your sugar up all of a sudden, like pain or you eating a really, really high carb load? Yeah. And Webby, I hope you're continuing to check your sugars frequently, even though you're not taking your meds. Go see your doctor at least once a year. All right. You have to care. We care about you, so care about yourself, girl. We got you. Okay, what else? Y'all, any questions for? So that was a good question about stress. Stress less. That's what the Superwoman complex is about. We don't need all this stress. Devastating effects. Hey, go Rice Girl. Hey. Check for the first time now in 6 months. Okay. Yeah. Okay. Hey, Jamila M. Okay. So let's think other things. So we talked about, if you're joining us, we talked about the definition of diabetes, how we diagnose it, the fact that it can be a silent disorder or you can have symptoms, meaning peeing all the time, always thirsty, so you're always drinking, always hungry, managing healthy weight. Don't check in Dr. Sutter, but I know numbers are good. Okay. I hope your numbers are good. We hope your numbers are good. Get them checked at least once a year. Stay healthy. Very good. Okay. What other thing? So, by the way, we talked about high blood pressure a couple of weeks ago, a couple of episodes ago. When you have diabetes, we are even more strict with your blood pressure because we want to protect your kidneys. Okay. Kidney health, clearly most of us know a diabetic who unfortunately may have had a horrible run with it, so ended up on dialysis. Dialysis or diabetes is probably the number one cause of dialysis or end-stage kidney disease that we have nationally in this country. So we are even more protective of your blood pressure when you have diabetes. When we talked about blood pressure before, usually 140 on the top number and 90 on the bottom or less is the goal. If you have diabetes, we want it even lower. Usually depending on who you ask, 140 over 80, 130 over 80. We want it even better control because we're very serious about protecting your kidneys as well as protecting your eyes, your heart, your limbs. We don't want people to lose limbs because the sugar over time, what it does, it's called a microvascular disease, meaning small arteries, nerves, blood vessels, nerves, right? Nerves, the people that have the numbness and tingling, the neuropathy of their extremities, that comes from diabetes because literally the sugar irritates and inflames those small areas. So think small vessels when you think about complications. So those small vessels can irritate the kidney disease. But I'm here to preach encouragement. Ministry of joy. I want us to be preventative. I want us to be proactive. I want us to say, okay, grandma had it, auntie had it, my sister, my brother had it. I can do something about it before I get it. Number one, I got to know what my numbers are. If you don't know what your numbers are, you can't do anything about them. That's why you have to go and get your annual checkups at least. And then, of course, if you have chronic disease, you need to be seen a little bit more frequently. Doctors just don't want to see you just because, okay? Let me put that out there. I know sometimes MDs get a bad rap, but we want to see you because it means something. We want to see you because we want to protect you from things. We want to see you to make sure that you're not suffering from side effects and complications of things that we can prevent, okay? So go and get your physical exams. If your doctor if you're on medications and they want to see you every 6 months, then go, okay? Confidence around doctor visits, how to face bad news, coping strategies. Hopefully every time you go to the doctor, it's not an unpleasant experience. You know, that's why I think going for your physical exam when you're feeling fine should give you some confidence. Hopefully you like your doctor. You know, if you don't like your doctor, have a good rapport with your doctor, get another one. There are plenty of doctors, plenty of nurse practitioners, plenty of physician assistants to go around, okay? You don't have to stick with one person. Go to someone who gives you a pleasant experience, and hopefully you're not always waiting to go to the doctor when you feel bad. Hopefully you're going for those annual wellness and GYN visits where you feel fine, you get a good report. I guess you just have to understand that even if you're given a diagnosis that you can, thank you, 3 minute, yay, I'm still on, the iPad works. You know, hopefully, you know, even if you're dealt bad news, the majority of conditions that we deal with are preventative and are treatable in some way with diet and exercise, okay? I have plenty of diabetics. I have plenty of folks that have high blood pressure that, don't jinx it, PG Ninjas, don't jinx it. That once we say, okay, this is what we have, or even if we have to start a medicine, that doesn't mean you have to continue it for the rest of your life. If we all do what we're supposed to do and that we know, you know, the things that we know that are helpful to keep us healthy, we're able to come off medication. We're able to reverse some of those changes. Don't smoke, okay? My Perry girls are trying to jinx me because my phone, thank you. My Android has usually cut off by now, but the Lord has blessed us with technology grace today. Our iPad is working. All right, last couple of minutes. Any other questions for me? The regiment between the sexes. Good question right away. So yes, the male metabolism, unfortunately and unfairly, not unfortunately, but unfairly can be higher than women, but the treatment is still the same for diabetes. Thank you, Melanie. You shouting me out. Active right mind, but oh no. Okay, yours active up, Jimmy. That's okay. Destin Doc. Milton is shouting me out. Thank you so much, Milton. So for those who are here in the Triangle area or nationally, today is the official day of my book launch of my second book. And we're having a big party tonight. I'm so excited. So I got to finish up working and get things together for tonight. Oh, no, Tyler's daddy is on too, Rod Ray. He's the other dude. So I'm excited. So join us. My book is available on Amazon. It's on Kindle. It's on audiobook. Superwoman Complex. We love it. Yay. During your periods, I'm not sure about during the period. I don't think there's necessarily a link, although if you're in a lot of pain or you have a lot of stress during that time, then your sugars can go up. So I've already picked a topic. Usually I have a poll where I have the folks chime in and tell me what. Minzy, sorry. Milton. Usually I take a poll, I take a survey, and I have you guys help me. You're welcome. Choose. Broadway is so funny. Help you guys, or have you guys help me choose a topic. I'm choosing the topic myself for next time. We're going to do musculoskeletal things that are related to stress, because I have a wonderful massage therapist, my lady, Miss Helen Jimerson Johnson, who hopefully can join me. But we'll talk about fibromyalgia, we'll talk about arthritis, we'll talk about rheumatoid, we'll talk about whatever, how it's related to stress and how to make those things better. Okay, is that a good one? So I think I might invite Miss Helen to come on and talk with us and maybe even talk about cupping. Cupping. Did y'all see Michael Phelps's? I have some too. I probably still have some scars, okay? So yes, please tune in. Hey, we got another guy. Yay! So let's do musculoskeletal things related to stress next Wednesday. Join me at 1:30 p.m. Eastern Standard Time. Join me on my Doc Swiner, I don't want to turn my camera, Doc Swiner channel on Periscope. Tonight, I'll be live broadcasting from my book launch party. Excited. And during the weekend, I usually do a post from Doc Swiner as well. Boop! I'm out. Have a good day, guys. Thank you for following and share with your friends, okay? Bye-bye.